there were a small handful of very politically activist therapists, and they are very, very strong proponents of affirmative model. And the frame is, if you don't affirm, then you're not properly practicing as a therapist.
It's like it's abusive, how they would frame it.
Yeah. And then there were a few others who really didn't know much about the issue, hadn't really had much experience with it. And then it's like the activists will spout all of their talking points of all the positive perceived benefits, which are really just like people feel better temporarily for a short amount of time. And one therapist was like, yeah, I've really seen that. And like, that's how they got her in the boat of this is what we should do all the time. Because what they're seeing in their offices is, oh, wait, I get this really great short-term spike of benefit. And then anybody who disagrees okay, yeah, you might be seeing a short-term spike of benefit, but what if you ask the question, okay, what is that going to look like in 5-10 years? Well, that's foreboding.
Yeah.
It's not a question.
I'm wondering
that you're,
sorry, go ahead.
That's not a question that you're really allowed to, and
No.
it's like allowed. It's like it's peer to peer saying, it's it's not even top down. It's not even from the instructors of the class. So like, I guess I do get why people with different points of views, disagreements of like, okay, wait a minute, what if this does cause harm?
Yeah.
What about the people who are coming out and saying that this has severely damaged their bodies and ruined their lives? And like, what about those voices? What about those detransitioners and what they're saying?
I'm wondering.
I think as a good therapist, you have to be like, okay, like what happens when I get a detransitioner client in my office? What is that conversation going to look like? How do we prepare for that? Because you may someday need the cultural competency of dealing with that. And nobody's going to, well, I'm not going to say nobody. Are we going to be allowed to have the cultural competency to deal with that?